and adopted by member states almost 30 years ago, we are still witnessing low implementation levels of key policy areas and low awareness of the immense harm that alcohol inflicts on individuals, families, communities, societies, economies. A recent OECD report predicts that during 2020-2050, countries of the region will lose about 1 year of life expectancy due to medical conditions caused by drinking more than 1 drink per day for women and 1.5 drinks for men, which then leads to additional costs for health systems. It also estimates that approximately 2.4% of annual health expenditure, or a total of 138 billion US dollars, will be spent annually on treating diseases like alcohol dependence, liver cirrhosis, or alcohol attributable cancers and injuries. This is equivalent to the current health spending in Australia, or more than double the current health spending in Belgium. In order to make progress and reduce the burden inflicted by alcohol, we need to tackle the gap between evidence and policy action. We know what works, and we know it's not being implemented. The Safer European Region initiative, developed by the European Centre on Prevention and Control of NCDs in Moscow, aims at supporting the implementation of the most effective and cost-effective alcohol policies, in line with the Global Safer Initiative. The Safer Euro initiative will include highlighting exemplar countries where evidence-based alcohol policies are improving people's health and well-being, and I'm glad that those countries, such as the Russian Federation and Scotland, are here today with us. I'm very appreciative for this. Today, we are thrilled to be co-hosting this event with the Czech Republic, shedding a light on countries that have introduced key policy measures to reduce consumption and harms. Countries that are committed to becoming safer countries of our region. Their efforts will help to galvanize politicians and policymakers across the WHO European region to increase their commitment to high-impact alcohol policies, promoting safer measures across different policy domains, so that harm due to alcohol is reduced and lives saved. I wish us all an insightful and fruitful session. Thank you.
Thank you for this inspiring words, Dr. Kluge. And now I have the honor to give the floor to Dr. Jürgen Rehm, senior scientist from the Center of Addiction and Mental Health in Canada and professor at various other institutions in Europe. Dr. Rehm will outline the WHO Safer Framework and present the latest evidence on alcohol consumption in the European region in the context of the ongoing COVID-19 pandemic. Please feel free to ask questions on the questions and answers. We will come back to them at the very end of the session. So, Dr. Rehm, the floor is yours.
Thanks a lot. I'm unmuted now. Thanks a lot for introducing me. May I please have the first slide? Thanks a lot. My task today is to walk you through the safer initiatives for the WHO European region, especially in light of the pandemic. Next slide, please. What are the safer policies? I think we are at the end of a session now, and most people know, but these is 5 different policies, which are both general population and high-risk population strategies, and which have been found in the past to not only be highly effective, highly cost-effective, but also easy and inexpensive to implement. The 3 population strategies are price increases via taxation or other means, availability decreases, and a ban on marketing. Next slide, please. Why is it necessary to do an alcohol control policy in the WHO European region? Well, the WHO European region is still the region of the highest alcohol consumption in the world. And as it has already been stated by the speaker before me, alcohol contributes significantly to the mortality and the burden of disease, not only in young ones, but all across the lifespan, and has been a major barrier to reaching health targets such as the NCD goals. Is COVID-19 also one of the reasons for that? Next slide, please. If we talk about alcohol and COVID-19, there are two causal directions possible, and I will discuss both of them. First, I will discuss the impact of COVID-19 on alcohol use and on harm. And secondly, I will discuss how alcohol use and alcohol use disorders impacted on COVID-19 and the attributable consequences and harm. The first, next slide, please. What did COVID do with alcohol use? And this is basically based on a lot of surveys and the first countries who have been doing this exercise of measuring. Well, all of it, it's a mixed bag. There seem to be two mechanisms. First of all, confinement often reduced alcohol consumption in countries, and that is by reducing the availability. Bars were closed, restaurants were closed. However, this effect depends on how alcohol was treated. A lot of countries, unfortunately, choose to make alcohol an essential good and loosened availability restrictions to cope with this effect. And so even in some of those countries with confinement, you had increased consumption because of loosening of internet rules of selling alcohol and others. In addition, and this is probably the most important part, there is evidence that those who already consumed alcohol heavily and people with alcohol use disorders increased their consumption during the pandemic. So overall, we have a mixed bag and unfortunately, long range, probably more harm. Next slide, please. What is the role of alcohol to the pandemic? Well, first of all, let us be clear. Alcohol, especially heavy drinking and alcohol use disorders, are weakening the immune system. And yes, alcohol is also contributing to COVID-19 by all of the other alcohol attributable diseases, diabetes, liver diseases. We've already mentioning them, increase the chance of COVID-19 and increase the severity of COVID-19. To give you just one example, the most striking example of how alcohol can impact on COVID-19, this is an analysis of 73 million US patient records. And it showed that people with alcohol use disorders had an 8-fold risk to acquire COVID-19, an 8-fold risk. That is striking. And so we can truly say that alcohol overall increased the risk of COVID-19 infections, not only in our region, but worldwide. Next slide, please. That brings me to the conclusion. Here are two figures which give some evidence why a paradigm shift for alcohol taxation is needed. And when I speak about alcohol taxation, I mean all means which financially act on alcohol price. It could also be minimum unit prices if they have the level of increasing the price of the cheapest form of alcohol. So financial measures are overall, as you see on the left-hand side, pricing policies and other financial measures are the least utilized when it comes to alcohol control policy in the 53 WHO European region countries. All other measures, and the most used is drink driving measures, are way more implemented, but we lag behind. And the right-hand slide figure gives you a nice picture how much we lag behind. In tobacco, the proportion of the final price, which are taxes, should be 75% in the European region, according to a WHO guideline. This is more or less the case in the WHO European region. For alcohol, every alcoholic beverage has, on average, only a taxation share of 15%. That means 5 times less than tobacco. A lot of alcoholic beverages are not taxed at all. For example, there are no taxation on wine in 22 of the 53 European countries. Overall, the taxation rate of alcohol and the pricing policies are abysmally low in this region. Given the high number of deaths, the harm, especially to young people, and the morbidity, it is time that we change and that we start implementing effective and cost-effective alcohol control measures, and pricing policies are the number one here. Thanks a lot for your attention.
Thank you very much for this very interesting presentation, Professor Rem. I think that we all can agree that COVID-19 pandemic has revealed the urgent need not only to strengthen the health systems and the emergency systems preparedness, but also to tackle inequalities where alcohol consumption plays a critical role in widening the gap and prevents us from achieving the sustainable development goals. So thank you very much. And it's now my pleasure to give the floor to the facilitator of our session, Dr. Ilana Kickbush, Director of Global Health Center, Graduate Institute of International and Development Studies in Geneva. Dr. Kickbush, the floor is yours. Thank you very much for being with us. You are muted. Ilana, you are muted.
Okay, they have allowed me to unmute now. Okay. So thank you very much for inviting me. Your Excellencies, distinguished guests, ladies and gentlemen, it's truly a pleasure to join you at this side meeting. And it's a very personal pleasure because I was actually responsible for the first alcohol action plan in the European region 30 years ago. So you can date me now. As we've just heard from Professor Rehn, there is more and more evidence emerging on the harms that alcohol inflicts on individuals and societies, and of course, particularly in the COVID-19 context, directly and indirectly. And there is more research highlighting the specific gaps in implementation and the areas for special attention, notably, as we just heard, taxation and pricing policies. We will now proceed with an extraordinary panel discussion with great participants and distinguished speakers who will reflect on the successes and the challenges they have experienced and the way forward to achieving a safer WHO European region free from harm due to alcohol. I'm very delighted to open this panel with a first reflection from our co-host, who you've already met, Ms. Alena Stevlova, Senior Advisor to the Minister of Health of the Czech Republic, and Director of the Department of Health and Care, Ministry of Health in the Czech Republic. Please, Ms. Stevlova, would you share some of the key challenges that you face in the Czech Republic in relation to alcohol policies, and perhaps even more importantly, your ideas of how to overcome them? Please, the floor is yours.
Thank you very much for such a thorough question. First of all, I have to say that unfortunately, the harm alcohol consumption represents really a big problem in the Czech Republic, as we saw. But I would like to mention that we have decided not to try to deal with this issue in an isolated way, but to focus more on the international cooperation. The alcohol consumption brings, except health impact, significant social costs, including lower productivity in daily work, higher crime rate, or domestic violence. And in this response to that, the Czech Republic adopted strategic documents such as the National Strategy to Prevent and Reduce the Harm Associated with Addictive Behavior in the years 2019-2027, and the Strategic Framework on the Development of Healthcare, which is called as a Health 2030. Both these strategies are based on an intergovernmental and whole of society approach, and we are keen on collaborating with a number of stakeholders and civil society. Ministry of Health has a very important, but also a very difficult task to change the perception of alcohol consumption in our country, where we often see it is as a nature part of our lives and even as a cultural phenomenon. At this stage, I would like to thank the WHO for the development of Safer Initiative, since it emphasizes on 5 key activities which completely meet our needs. Another challenge is the alcohol advertisement. We have initiated a close cooperation with the National Drug Coordinator, who is directly subordinated to the Office of the Czech government. And our common goal is to prepare a special law that can efficiently regulate the alcohol advertisement even in online environment. A first draft has been already prepared. I cannot omit a broad availability of alcohol in the Czech Republic. Ban on sale in gas stations or during culture and sport events, especially in case where children are participating, are all among measures that can be considered. We are also discussing a regulation of time availability of alcohol outside restaurants and bars. Last but not least, the strict compliance with the law in force, which demands not to sell alcohol beverages to persons younger than 18, is extremely important. Furthermore, we can think about more severe sanctions for violation of regulation and support municipalities in the implementation of the Act on Protection of Health from the harmful effects in addictive substances. Additionally, increasing alcohol taxes is a long-distance run, even though it's one of the main recommendations made by OECD and by WHO experts that can help to improve the health status of the population. We don't use the adaptation of taxes based on the inflation rate, and taxes are rather stable in the Czech Republic, which means that their relative level even declines in relation to incomes. It's necessary to lead a constructive and intense dialogue with our colleagues from other ministries, for example, on the topic of non-zero tax on silent wine. As you see, there are many challenges ahead of us, but I believe that also thanks to international cooperation, we have a good platform to knowledge sharing and evidence-based approach that undoubtedly help us to pursue our partners and citizens how low or even zero alcohol consumption can improve their daily lives. Thank you for your attention.
Thank you very much, Ms. Stevlova, for that presentation showing the reality in many countries of dealing with alcohol. You mentioned particular changing the perception on alcohol consumption, which is a really difficult task, and I believe today's discussion can perhaps move us forward a step in the right direction. Fortunately, though, we also have very concrete examples from countries where the safer measures have been introduced and have led to substantial decreases in alcohol consumption and harm. For today's session, we are honored to have high-level representatives from these countries with us, and it's my great pleasure to introduce our next panelist, Her Excellency Nicola Sturgeon, First Minister of Scotland. Scotland was the first country in the European region that had a national alcohol strategy in place, which endorsed and embraced the WHO's SAFER at the initiative at the country level. Your Excellency, the WHO was very pleased when minimum unit pricing was implemented in Scotland in 2018 after a long legal battle. Some of us watched that very carefully. Given that pricing is the least implemented SAFER policy arena in the entire WHO region, what messages can you share from your experience from that battle to implement the minimum unit pricing in Scotland? Please, Minister, we're delighted to have you. The floor is yours.
Thank you very much, and it's a real pleasure to take part in this discussion today, and thank you to the WHO and also to the Czech government for inviting me to take part. Scotland, of course, is not unique in the problem we have with alcohol misuse, but the severity and extent of the challenge we face does set us apart, particularly when we compare our own situation to other Western European countries. Our levels of consumption are higher than the European average, and we have some of the highest rates of liver disease and cirrhosis anywhere in Western Europe. So it was in light of that very severe health challenge that in 2012, we, as part of a package of measures which formed our alcohol action plan, passed legislation to introduce minimum unit pricing. The reason we decided on minimum unit pricing was partly because the devolved Scottish government doesn't have control over alcohol taxation, so it was the pricing lever we were able to use. But in tackling the affordability of alcohol, minimum unit pricing is also a flexible policy because you can vary the level of the unit price to take account of rising household incomes and make sure that the affordability of alcohol is continuing to have the right balance. And it also gives us the ability to tackle very high strength, low price alcohol products. And that was a key factor in our decision. As you say, we fought a lengthy legal battle where we were taken through every level of the legal system by the alcohol industry to try to block the introduction of minimum unit pricing. Eventually, we prevailed and were able to implement the policy in 2018. And in the year following the introduction of the policy, we saw a 10% drop in the number of deaths related to alcohol. So very, very quickly, we saw the impact of that policy. Now, since then, of course, the pandemic has had an upward pressure on alcohol consumption. So we've seen some of that progress interrupted. But all of our experience to date convinces us that minimum unit pricing is a critical tool in our overall approach to tackling alcohol misuse. What would my reflections be and messages to others? Firstly, it would be to recognise very clearly and very explicitly that an alcohol strategy is always going to be less effective than it might be if there isn't a pricing mechanism as part of it. Secondly, having recognised that, governments need to be prepared to be determined and to persevere. Our experience tells us that the alcohol industry will resist any innovative measures like this. So perseverance at various stages in the legal battle we fought, it would have been the easiest political thing to concede defeat and decide that we weren't going to move forward. We didn't do that. We were determined to see this through, despite everybody predicting that we would ultimately fail. We didn't. We prevailed. And lastly, again, this comes from our experience of having to win in the face of legal challenge, is make sure you build a really strong evidence base. The evidence for the relationship between pricing and reducing alcohol consumption is very clear, but you have to build that evidence, make sure you do your homework, and then be prepared to persevere and show determination. In summary, and my final comment is that I am more convinced than I was even at the outset of our lengthy battle to introduce minimum unit pricing, that it is a really effective tool. It's not the only tool government should use. The safer sort of package of policies are really important. But without that pricing mechanism, everything else that governments do will be less effective. And that is a hard lesson that we have learned. And I think it is a hard lesson that the rest of the world has to learn too. We continue to look to other countries for inspiration, but any government who wants to learn from our experience, we'd be very happy to share that experience and share some of the evidence base that proved to be so important to us in ultimately prevailing. But I'll leave it there, and thank you again for allowing me to be part of this discussion.
Thank you very much, First Minister, and thank you for the lessons that you've shared. And I'd just like to reiterate, first of all, the political courage it takes to go down that road, and your two messages of perseverance and evidence, and that the two needs to come together in order to be taken forward. There are some other countries that will be joining us now that are considering the minimum unit price also as a viable option. The Russian Federation is an exemplar country in implementing evidence-based alcohol policies, so focusing on that second dimension that the First Minister mentioned. And it is my pleasure to introduce a short video of His Excellency, the Minister of Health of the Russian Federation, Mikhail Murashko. WHO is encouraged that the Russian Federation is continuing to implement and maintain effective and cost-effective alcohol policies now over several decades, including those related to the 5 safer priorities. We have asked Dr. Murashko to reflect on what has been achieved in the Russian Federation and the lessons learned. So let's just listen to his video statement.
Уважаемые коллеги, употребление алкоголя является третьим ведущим фактором риска возникновения психоневрологических нарушений и многих других неинфекционных заболеваний, способных привести к преждевременной смерти и инвалидности. Вместе с тем, этот фактор является предотвратимым. Высокий уровень потребления алкогольной продукции в нашей стране в 90-е и начале 2000-х годов привел к снижению средней продолжительности жизни и росту преждевременной смерти, что потребовало принятия срочных мер. В этой связи была разработана и принята концепция реализации государственной политики по снижению масштабов злоупотребления алкогольной продукции и профилактике алкоголизма среди населения Российской Федерации на период до 2020 года. Помимо значительного снижения уровня потребления алкоголя, концепция также предусматривала повышение эффективности системы профилактики злоупотребления алкогольной продукцией и меры регулирования алкогольного рынка. Многие разработанные меры имели долгосрочный характер и были интегрированы в национальные задачи по борьбе с неинфекционными заболеваниями посредством комплексной профилактики факторов риска. Это позволило достичь ощутимых результатов. С 2008 по 2020 год потребление алкоголя снизилось с 15,7 до 9,1 литра на душу населения. Смертность от случайных отравлений алкоголем в 2008 по 2020 год снизилась на 60%. Серьезно снизилась и первичная заболеваемость алкогольными расстройствами. Многое было сделано для того, чтобы приблизиться к этому результату, и успех был достигнут благодаря сильной политической воле и четко выстроенной системе контроля обращения алкогольной продукции. Успех государственной политики связан с реализацией всего комплекса антиалкогольных мер, рекомендованных Всемирной организацией здравоохранения в соответствии с глобальной стратегией сокращения вредного употребления алкоголя. В этом году мы также отмечаем 10-летний юбилей первой глобальной министерской конференции по здоровому образу жизни и инфекционным заболеваниям, которая прошла в Москве. Московская декларация, принятая по итогам конференции, впервые выделила приоритет борьбы с инфекционными заболеваниями в глобальном масштабе. Дала толчок популяризации здорового образа жизни, смены парадигмы развития глобального здравоохранения. Отмечу, что в нашей стране основные положения Московской декларации выполнены полностью. Российская Федерация продолжает реализовывать комплексные мероприятия по профилактике алкоголизма. Проводится работа по укреплению наркологической службы. Поддерживается круглосуточная горячая линия по здоровому образу жизни, бесплатно для граждан. В рамках федерального проекта формирования системы мотивации граждан к здоровому образу жизни, включая здоровое питание и отказ от вредных привычек, разрабатываются и внедряются новые эффективные популяционные меры как информационного, так и регуляторного характера. Изменение отношения общества к алкоголю – длительный процесс. Но наш пример показывает, что это возможно. Российская Федерация твердо привержена видению безопасного европейского региона ВОЗ, свободного от вреда, причиняемого алкоголем, и предпринимает все усилия, чтобы воплотить это видение в жизнь. Благодарю вас за внимание. Желаю вам крепкого здоровья.
We thank Dr. Marashko for this video address and also the messages contained there. First of all, of course, it is inspiring to see how much was achieved in such a large country over a relatively short period of time. And there are so many lessons to be learned from the Russian alcohol policy. One of them we've heard from the minister, which is also integrating this into a larger policy on non-communicable diseases and on healthy lifestyles. We are very lucky that we will now have some short additional comments from Dr. Oleg Salagai, who is the Deputy Minister of Health of the Russian Federation. And Dr. Salagai, can you please give us a short comment on the current challenges that lie ahead for the Russian Federation in view of the steps that you have already achieved? The floor is yours.
Thank you very much, Dr. Kickbush, and it is my privilege to participate in today's event. Let me take this opportunity to extend, first of all, my gratitude to the WHO and separately to the head of European Bureau, Dr. Kluge, for his leadership and commitment. Many thanks to our moderator, Dr. Kickbush. Important points have already been noted by the Minister, Professor Murashko. Answering your question, I would add the following. First of all, we see that in all countries, alcohol is perceived as a risk factor, mainly by ministries of health. However, reducing alcohol consumption needs engaging all sectors of government. It should be said separately about economic measures. We all have yet to learn how to base our economic policies not only on accounting for excise tax revenue, but also on estimating alcohol-related losses. I'm sure that the investment case that being implemented by WHO will be an important step on this path. Another challenge is the implementation of a new set of measures. As of today, the main measures in the Russian Federation have been reflected in the legislation. However, it is difficult to find a consensus of international and national experts on the new measures, which make their translation into policy rather difficult. It is necessary to increase the availability of medical and social aid for alcohol, for people living with alcohol addiction. An important step in this direction is elimination of stigma, both in relation to the addict person and to the narcological service. It would not be wrong to say that while surgeons often save lives, drug therapists, psychiatrists, save destinies. Finally, we must look for new communication tools to motivate people to consume less alcohol. In the digital age, we need to be modern and persuasive. So that would be my answer to your question, Dr. Kickbush. Thank you.
Thank you very much, Dr. Salagai. And of course, experience with health in all policies, the integration of health and social services, and the use of new mechanisms like digitalization, new tools that we have are absolutely critical because they too work in both directions, either supportive or to be dangerous. We are now very lucky to move into a second round of questions to all of our distinguished speakers, including our co-chair. And we would like to think that in drawing on many years of experience with tobacco policy, we have a framework convention, a WHO framework convention on tobacco control. That has increased the implementation of measures across several policy domains, resulting in reductions in tobacco consumption, health harms. As we have heard earlier, effective alcohol policies are too often not implemented in too many countries. So increasingly in our consultations on the future of the European Action Plan on Alcohol and the Global Action Plan on Alcohol, as well as at this year's World Health Assembly, which many of you attended, WHO is hearing calls from member states for a treaty for alcohol, a framework convention on alcohol. So I would like to hear from each of our distinguished speakers in turn, any ideas that you have about how to build a more effective international framework for alcohol control. Will countries need to go beyond the vision of a safer WHO European region by, for example, agreeing that alcohol harm can only be addressed by an internationally legally binding framework? So please allow me to start with you, Ms. Devlova. What are your perspectives on this?
Let me contribute to this question. Harmful use of alcohol is a global problem and should be treated as such. It means globally, on global fora. But we have to be aware that a completely unified approach can be hardly reached because of different culture and different history of member states. But on the other hand, we cannot give up on these efforts just because it's a difficult task. If the international community decided to set out for a journey of international treaty or similar instrument, the international organization would have to build common trust in such an instrument and ensure its real ownership among member states. Without proper implementation, no treaty can be efficient. Thank you.
Thank you very much. Compliance, of course, is an absolutely key issue on any treaty, as we know, including some of the big environmental treaties that we are dealing with now. So thank you very much. I'd like to turn to the First Minister and ask her the same questions. Will countries need to go beyond the safer WHO vision of the European region by agreeing that alcohol harm can only be addressed by an internationally legal binding framework? What is your position on this, First Minister?
I definitely believe that there is a need for greater international commitment and action, but I also agree with the previous speaker that we also have to recognise differing circumstances and legal frameworks that exist across different countries and take account of those. What I do think is that very strong policy frameworks that countries feel obliged to seek to follow, even although they might do it in different ways, is important. And that's why I'm such a big supporter of the Safer Initiative and attach so much importance to WHO's upcoming alcohol action plan, because I think that gives a really strong steer in the right direction. There may be lessons to learn from the Tobacco Convention, but I also think we need to consider some of the specific issues around alcohol and make sure that we address those. Two final points I would make. I do think we need to learn from each other's experiences and follow good practice. When we were introducing minimum unit pricing, we looked very closely at Canada, and the offer remains for us to share our experience with other countries. And we've got to turn aspirations into action. I mean, the question about going beyond the Safer Initiative is a valid one, but I was struck by the presentation earlier on that too few countries are yet living up to the Safer Initiative because we're not doing consistently enough on pricing, for example. So it is about, I think, much greater collaboration and cooperation, but being prepared to learn from each other and being willing to say whatever political risk attaches to this is that we all have to raise our game because this is a global problem that needs global solutions.
Thank you very much, First Minister, and I understand the regional director wants to come into the discussion at this point. Please.
Thank you, Eleona. I wanted to thank really the First Minister for, a tremendous commitment to public health and to evidence-informed alcohol control policies. I used to work in my previous capacity a lot with Harry Burns, the Chief Medical Officer, and he used to tell about the vision that Scotland to be the best place for a child to grow up. And we were always very inspired, and frankly speaking, I understand even more so, and congratulations for your determination to prevail. I think that's really the leadership that we need, and you set the bar high, First Minister, and we have to all, as a region, to go to that benchmark. Thank you so much, and please stay healthy.
Thank you very much, Hans. Thank you, Regional Director. And of course, linked to that is all the initiatives Scotland is taking around the well-being economy, which also Sir Harry Burns has pushed forward so tremendously together with the First Minister. So we will now hear from Dr. Salagai and ask him what he thinks about this question, if countries should go beyond the Safer Initiative and start to think about an internationally, legally binding framework. Dr. Salagai.
Большое спасибо за ваш вопрос, госпожа Кикбуш. Мне кажется, что для международного соглашения, конечно, должен быть международный консенсус. Но также мне хотелось бы отметить, что я не вижу противоречия между возможностью в будущем обсуждения вопроса о международном соглашении и реализации инициативы SAFER, поскольку SAFER также предполагает регулирование как неотъемлемый элемент снижения потребления алкоголя. Поэтому, наверное, это определенные шаги на одном большом пути. И мне бы хотелось согласиться с тем, что сейчас прозвучало от госпожи первого министра по наилучшим практикам. Это чрезвычайно важно, поскольку опыт различных стран, эффективность мер в различных странах часто являются основанием для принятия соответствующих решений в других государствах. И очень важно, чтобы такие решения были обоснованы, правильные, основанные на экспертном мнении и на научном фундаменте.
Thank you very much, Dr. Salagai. And that, of course, reinforces one of the 2 points that the First Minister put forward. You know, you need the political perseverance. And I think any treaty initiative would need a lot of perseverance, but you need the evidence. And this, I think, is also where the work of the WHO Regional Office is so critical. I believe that the First Minister has to leave us for some other duties. So I would like to turn to Karina to perhaps say goodbye on behalf of the chairs.
Thank you very much, Ilona. And indeed, we would like to thank First Minister for taking the time to be with us. We know how busy you are and with all the commitments and how you were able to make a little space for coming here. So we are very, very grateful that you could be with us in our discussions, and we hope to continue engaging with you on further discussions on how to build this safer initiative in the European region. So thank you very much, and we wish you well. Thank you.
Thank you very much. So before we hear from civil society, we will hear some voices from there. We will present sharing the vision and optimism of the Safer Initiative. In German, we would say Film ab.
If you look around, you see every day in hospitals, in emergency rooms, that alcohol is bringing many people to these emergency rooms. I think it is important that we reduce the harm which is related to alcohol use. And I don't think that people are aware that alcohol is responsible for many different cancers. Many women do not know that alcohol causes breast cancer, and they have the right to know. And therefore, they will be able to choose if this is a risk that they are willing to take. What is in question here is that people do not really necessarily know, as they did not know for tobacco, that alcohol is harmful for their health from the first drink. So my hope for the future is basically to have a safer Europe from alcohol harms. I believe we can create a wave of change. I think once countries understand the value of changing their policies and reducing alcohol consumption, they really change. And this has already been started. We have countries that have implemented policies that work, that have saved lives, and will continue to save lives. And they actually are called the WHO best lives. These policies are important because they produce results. We know that from the evidence, and we know that if they are implemented, they cannot only reduce harm, but they can actually increase life expectancy. So the WHO wants to create an initiative, and we have already launched this initiative called the Safer Initiative. The Safer Initiative is basically aiming at creating a vision for a world free of alcohol harm. For us, there are three priorities. First of all is that we know that there are countries which are doing very well in terms of implementing WHO best practices. Russian Federation has introduced evidence-based policies that have reduced mortality and has increased life expectancy. We have Scotland that has introduced also evidence-based policies, namely minimum unit pricing, that also saw many results. And we have other countries that we know are going to introduce these policies. Then our second priority would be to be able to support countries in implementing the WHO best practices. So those policies that we know would work. And for that, the WHO will be providing technical support and facilitating exchanges in terms of knowledge learned, lessons learned in countries that have already implemented this and have achieved results. Then we also want to create a civil society movement which is engaged in supporting this reduction of alcohol-attributable harm. So as a policy maker or as a country representative, you can make your country a safer country by making sure that policies which work and will reduce alcohol consumption and attributable harm will be implemented. So I think that by creating and implementing evidence policies that do change the environment, that do change the lives of people every day, we will be able to introduce more changes in other countries. And we see that countries are following some of the good examples that we already have in our region.
Thank you very much for this film, and nice to see you double, Karina. So I don't know if one now says in video and real life, even though it's double video, but all the same. So, ladies and gentlemen, we've heard from some member states representatives about their vision of a safer WHO European region, and of course also some ideas around a treaty. You just heard from Karina the need for a civil society movement. So, of course, for our meeting here, the voice of civil society is absolutely critical, and they have been invited as key partners to lay out there about how we can achieve this vision together, obviously. So I would like to introduce Ms. Florence Bertoletti. She is Secretary General of Eurocare, the European Alcohol Policy Alliance, and then Ms. Kristina Sperkova, President of the Movendi International. We've asked them to answer the following question, particularly from the perspective of civil society. What would you say should be the number one action that should be prioritized by member states working together to achieve a WHO European region free from harm due to alcohol? So, Ms. Bertoletti, how would you start? What would be the first thing, the most important thing that you would do, or that your organization has already said should be done? Please, over to you.
Thank you so much, Ilona, for the question. And the first thing that Eurocare would like to actually say is to congratulate the the regional office for Europe for its Safer initiative, which is in itself a tremendous achievement, and also to applaud really the specific support for a civil society movement. This is not to be understated. So we are looking forward to the Euro region as a safer country with the safer country champions that are here today for taking the lead on this dossier in the world. The first thing that I would say to respond to your question is actually to quote or to talk about the WHO UNICEF Lancet Commission report, which was launched last year, and that said that no country was doing enough to protect children. And they made specific recommendations, which you will see at the end, are linked to the SAFER initiative. As was said by previous honorable speakers, we know that increasing prices on alcohol is a win-win-win measure, but we also know, and we've heard, that raising prices on alcohol is still completely underused. Even yesterday, during the discussion on the financing mechanism, no one, even though the report was brilliant and the Director General and all the presentations were absolutely fabulous and clear. It's the first time, by the way, also myself, I understood the budget, but no one mentioned the role of health taxes during the debate. So what are our recommendations? Well, health ministries and the WHO needs to help them, need to be better, really make an effort at speaking like investors to their counterparts in the Ministry of Finance, and also to develop their narrative regarding health taxes and generally safer policies, so that they see it as a return on investment, which should also be seen as a huge political capital. There's a huge capital, political capital that should be associated with it. I mean, we've seen it with Scotland. They are leading the way. Everyone is talking about Scotland around the world. There's a huge political capital associated with doing the right thing with safer policies. Also, member states and the WHO should support this dialogue, public debates, discussions with ministries of finance and ministries of health. And another very important thing is, I think, the WHO Europe should work very closely with the multilateral collaboration formed under the auspices of the SDG GAP Sustainable Financing Accelerator, which is, you know what it is, to support the work on alcohol and health taxes. Now, and that will be my last thing, regarding a global mechanism for alcohol control, we absolutely, in the civil society movement, believe that it's urgent and of the utmost importance. And we call on the WHO Euro region to evoke Article 19 of the WHO Constitution to draft a convention on alcohol control. And that's my last thing. If that is not possible, that at the very minimum, then concrete steps to add an optional protocol to the Convention on the Rights of the Child to protect children from the awful marketing of alcohol, as well as other unhealthy products, should be pursued by a broad coalition of countries and UN agencies. That's it.
Thank you very much, Florence, for these points, and particularly for the focus on children. And of course, it was the focus on children that also changed the approach to tobacco and led to stronger legislation. So maybe those are issues that we still have to look much stronger and also have alliance with those that deal with children's health. If I might add something as a moderator, I much prefer to speak about taxes for health rather than health taxes, because people might be understanding the wrong things, that we're taxing their health. Can I just ask everybody to please also take the trouble to look at the chat? There's some really interesting discussions going on here, not the usual just, question and answer thing, but really lively discussion around different economic and financial mechanisms one can undertake and what actually is a smart tax design. That's one of the terms that is being used here. And I think in that context, if we think that through, what the smart tax design is, how different stakeholders relate to it, how the whole issue of inflation relates to it. So many of those things are being raised in the chat. One person is also really focusing on the need to really do a lot on the population level rather than concentrate only on individual measures. And that, of course, has often been the case when countries don't have the perseverance to go down the population health track, which often means policy, which often means regulation. They tend to defer to individual strategies, and they alone, as we all know, are not sufficient, while they can be important in many contexts. And of course, as other colleagues say here, no one strategy works on its own. Also, minimum unit pricing needs other mechanisms around it to move forward. And our Russian colleagues made that very clear, the integration into a larger lifestyle policy. We heard about health and all policies and issues like that. So it's now my pleasure to turn to Ms. Berkova to also share with us her perspective, the Movendi perspective on how issues should move forward, issues may be related to a treaty, but also the specific civil society contribution. Please, the floor is yours.
I am now unmuted. Thank you very much for the question and also for inviting Movendi International to contribute to this event. If I had more time, I would talk about like 3-4 important actions that are crucial to prevent and reduce alcohol harm in our region. One of them would be alcohol retail monopolies, for example. Our region already has great experience and very good evidence showing how effective and important this measure is. And by removing the profit interest from alcohol retail, countries can effectively protect people from the harms caused by the products and practices of the alcohol industry. But if I had only one Christmas wish For immediate action, I would start with something that is realistic to implement right away and that is still ambitious in its impact on life saved. And I will not surprise anyone. I would talk about the need of public health oriented alcohol taxation. And the COVID-19 pandemic has clearly shown that there is an urgent need. It would help to prevent death and reduce harms and mobilize more domestic resources, enable health systems strengthening and reduce inequalities. But what we need is really a joint regional initiative to advance alcohol taxation. That way we would avoid the cross-border issues we see, for example, in Baltic states. International institutions such as WHO, OECD, the World Bank need to come together in support of countries to build capacity to implement public health-oriented alcohol taxes. And this initiative is also about building a clear and well-functioning infrastructure. For example, a ministerial conference where leaders can come together, discuss, and chart the way forward. Of course, there is a reason why alcohol has become more affordable in the last decade and why the single most effective alcohol policy solution is neglected, and it's alcohol industry interference. What it does is that alcohol policy is not approached with the public health imperative, but with the imperative of safeguarding the profits of the alcohol industry. And that's why we also need stronger tools going forward. We need a global binding treaty on alcohol that puts the human right to health in the center of policymaking and that facilitates much stronger protection against conflict of interest and alcohol industry interference. These two solutions I named are not revolutionary ideas. They exist for other public issues, public health issues. Members of Movement the International work every day across the region in communities and see the harm. And whenever we talk about solutions that are available, like taxation or like approaching alcohol the same way as tobacco industry, it makes sense to people and they support it. So what we need is leadership of this leadership on these solutions that scare the industry but protect and benefit the people. Thank you very much.
Thank you very much, Ms. Berkova. And I was reminded of our discussions also with the First Minister, because it's interesting to see that a country that is trying to move measuring its own success beyond gross national product, which could include the growth of the alcohol industry, is actually thinking about a well-being economy where success is measured differently. And I think the kind of things that you put forward in relation to the kind of economic and protective measures that should be taken is that the value of public health ranks higher than a number of the other things that now are defined as the success of our societies. So these issues also in which the regional office has really been a leader in relation to well-being and health really come together, and we can see how closely related they are to financial policies, taxation policies, and issues as we have discussed them. So thank you very much for raising this. And we have seen how important it is to have a civil society here with us, and hopefully they will move forward in helping create that social movement to move us forward. We do have another contribution from a member state. We have in the chat Andrei Martin Kovac, the health attaché from Slovenia, has asked for the floor. Slovenia has long been interested in alcohol policy. It holds, as you know, right now, the presidency of the European Union. So, Mr. Vukovac, would you like to take the floor, please?
Thank you very much for giving me the floor. Dear Excellencies and colleagues, Slovenia really warmly welcomes the side event, and we would like to express our greatest appreciation to the host for organizing a space to discuss this important topic. And especially we welcome the inclusion of civil society in this event, as they're a key player and ally in alcohol control policies. And it was fantastic to hear that their ideas, as well as the ideas from some high-level government representatives. As was mentioned, Slovenia is really working hard also to implement the safer measures nationally, and we will hopefully be joining other champions that were shown in the video soon. We, as always, are grateful for the WHO support we receive in this regard. And furthermore, we would like to call upon all member states to show their commitment and responsibility to strengthening the alcohol control policies by actively engaging with current processes, namely the drafting of the action plan to effectively implement the global strategy to reduce the harmful use of alcohol. And we also believe that we should not stop there. To really commit to proper alcohol control, we need a binding global instrument or treaty to solidify our commitments, which has already been addressed today in the session. And we also believe that we need to invest more into WHO capacities to address these issues. Slovenia, as a long-standing alcohol control advocate, is proud to keep up these efforts also in our work in the WHO Executive Board. And we invite other member states and relevant non-state actors to join us in working very constructively to a safer world. Thank you very much.
Thank you very much for this contribution and for all the work you have been doing in this area. So now we would actually have some time for some questions. If you do have a question, do put it in the chat. But what I would like to do now is to ask Jürgen Brehm to perhaps comment on what he has heard in the face of his initial presentation. I hope he is still with us.
Yes, I am. You have unmuted me.
Excellent.
So I'm here. Now the reactions to the presentation and on the chat are very important. And I think after a short misunderstanding that we do not want to take minimum unit pricing and put it against taxes, that those measures are complementary and we need both of those measures and both should be adjusted for inflation in order to come up with the optimal financial structure. But we are talking about something, and we should always think about it, which actually is much underdeveloped. We are doing as if we can put measure A against measure B in a situation then for decades, financial measures in alcohol control policy have been dormant. If you look into a simple fact, how much does an average worker in Europe or in any country of the European WHO European region have to work for buying a beer or for buying a bottle of wine or for buying a bottle of spirits? Alcohol has becoming so much more affordable, also compared to other consumer prices. And so this is the most urgent thing, to do something in this financial aspect. And I think on this chat, which of course is not surprising because it's a WHO event and there's a lot of people who are interested in public health, everybody agrees that we have to do something urgently to actually stimulate that. And the final point which I would like to make is that we should not get stuck in some of those past solutions, some of those past things like public health people are against value-added taxes, etc. We do have much more sophisticated and developed taxation designs. We just have to ask the experts and the political willingness to actually implement them.
Thank you very much, Jürgen. I'd now like to call on Franco Sassi to explain to us some of the really interesting things he has mentioned in the chat.
Thank you, Ilona. I'm very happy to expand on that briefly. I'm really following up on what Jürgen just said. I mean, there are experts who really know, how taxes can be designed. I mean, the problem is that these issues are being discussed in, a very closed community, which tends to be dominated by public health professionals, which of course have fantastic knowledge in their own field, but taxes are a very specialist subject that really needs to be addressed by those who know about economics and taxation theory, which is a very specialized branch even in the economic discipline. So there are many ways in which taxes can be designed, addressing all of the concerns that have been expressed in today's meeting and in the chat. And when I mentioned smart tax design, I mentioned that because it is possible to do much better than countries are actually doing at the moment in terms of designing alcohol taxes. If there are taxes that are really poorly designed, even among what we call health taxes, these are the taxes that we apply on alcohol. These are some of the least effective taxation measures in pursuing public health objectives. So I really hope that we can work together with experts in taxation theory to design taxes that can really achieve the purposes that we want to achieve in public health.
Thank you very much, and thank you for your little comment about health taxes and taxes for health. That's of course nice if that would work in the book. There is an interesting question here by another colleague which is actually a question to WHO and referring to the opposition of the industry to innovative policy approaches, and that of course everyone in countries trying to implement the SAFER initiative is faced by very strong industry opposition. And there is the question here, how can we more consistently and effectively manage its conflict of interest? And now it comes, how can WHO support and encourage member states to do so? Can I turn back to some of the WHO colleagues, perhaps, to answer this question? In what way one can address this? I know that WHO has begun to work much more also on the commercial determinants of health, and of course a whole number of these issues are then addressed also in an innovative way under this kind of approach, which takes into account a whole range of strategies that the commercial and the industry sector takes. So could one of the WHO colleagues maybe say a word about that?
Yes, of course, Ilona, with pleasure.
Thank you.
Thank you very much for giving me the floor on this question. I think this is one of the questions that people raise quite often, and especially member states, because they are confronted, in fact, with the strong interference from economic operators whenever they want to implement policies that we know work. I think it has been said, and the First Minister of Scotland made it very clear, we need to have the evidence behind the policy measures that we implement in countries. And there's a lot of evidence in terms of the use of pricing policies. The evidence is very clear. She also mentioned that, and WHO is constantly working on making sure that we have more and more evidence. We have been publishing in a very regular basis, and we just had a paper published in The Lancet, and there's more coming up. On making sure that this evidence, the changing on the evidence that we have, for example, on the links on alcohol and cancer, first from first dose, that this gets out, that this is published, and that this can be used by the member states. Of course, these are all arguments that are evidence-based and that governments can use. And I think it's also important that WHO is starting to work on the commercial determinants, as you said, because we need to have better ways of understanding how we are going to proceed in terms of counteracting the arguments from the alcohol industry. I've seen many arguments which are given to Ministry of Health or Ministry of Finances that many times are everything except led by the evidence that we have. So it's time also to equip our governments, our ministers, with the evidence and with the arguments that they need to be able to to support and move with the policies. It's also time to engage the civil society, as we mentioned, and we want to engage civil society to support the government. We know that ministers of health, without the support from other ministries and without the support of the civil society, will not be able to proceed in many difficult times. And we know that for Scotland, for example, the role of civil society was key to be able to support the minister in moving forward with this legal action. So we are very keen to have in our Safer initiative, and as part of also other initiatives that Dr. Klug will also mention in his closing remarks, that we are very devoted in supporting, making sure that the evidence is there and that the civil society, the ministers are equipped, well equipped with the counter arguments that we need, as we did for the tobacco. Thank you.
Thank you very much for that, Karina. And that, of course, reflects also what some of the other points that are being made in the chat about the whole of government approach. But of course, what you indicate is also the whole of society approach, because what we built up with tobacco over the years was that it was no longer acceptable. And this whole of society approach shows how important civil society is, because it has to be in everyday life, that understanding. And that was also the point made early on by the representative from the Czech Republic. You know, the mind frame that we have around alcohol, how we think about it in everyday life, is also part of this. So in terms of financial instruments, of course, there is another element that possibly one can learn from tobacco, and that is this whole initiative about not investing in tobacco. And you know, there is a big initiative that is trying to encourage pension funds, sovereign wealth funds, etc., no longer to invest their money into tobacco shares. And maybe there is, you know, some alliance that can be built here around an economic and financial strategy that is different. Does anybody else want to give a contribution? I'm trying to listen, talk, and read the chat at the same time. So I hope I'm not missing something, but as it is said here, this WHO resource on financial instruments can be very, very helpful. And of course, I guess we all agree that as important as Lancet publications are, we of course would all like to be in the Financial Times and elsewhere as well, putting that argument broadly. Also at important meetings where health and finance ministers come together. And we can see that much of the global health debate also through COVID-19 is opening the door for a new kind of financial and economic debate that we have not had before. I would very, very much like to ask our two civil society representatives if they have a short addition that they would like to make. Ms. Berkova, would you like to make a comment?
Yes, thank you very much. I would actually like to. I would like to add one dimension of the whole SAFER package, because we have those 5 initiatives that we have presented, but then there is also the protect and monitor part, and I would like to actually address the protection from the industry and also the question whether WHO actually should engage with the dialogue with the alcohol industry. So it's maybe a rhetoric question, as you could understand, but we would suggest the WHO actually does not engage with the industry, and the SAFER package also in a way supports that. Thank you.
Thank you very much. And any more comments?
Yes.
Okay, go ahead.
I would support this. I think that the WHO could definitely develop a standalone document regarding the conflict of interest between the alcohol industry and public health interests. It's actually, there's no difference clearly between the alcohol industry and the tobacco industry. And we need that standalone document written by the WHO. And there's another thing that I wanted to say, which is more of a little story, but stories sometimes go very far. I was privileged to be present during the universal health coverage discussions in New York. And the current Director General of the WTO, I can never pronounce her name, an amazing lady. She kept constantly talking about health taxes or taxes for health as a way to finance universal health coverage. She said it 3 times, 4 times, 5 times during all the proceedings. She was part of the Bloomberg Fiscal Policy Task Force in the same way as the Honorable Nicola Sturgeon was. And I think the WHO should reach out to her, because the relationship between alcohol and trade is very important. And here is a lady who understands the dangers about the alcohol industry. So this is my little story.
Thank you very much. And given, a whole range of developments around COVID, last not least a trip waiver, I think Dr. Tedros and Ngozi are in very regular discussions. So thank you, Florence. But a really, really important point also about trade and, of course, health services, health systems, investments in UHC and primary healthcare. And the interface, how some of that financing could take place in that way. So I think we've had some fantastic additional points from the additional speakers. Thank you very much, and thank you for being so active on the chat. It's really a joy to read those many contributions. I'd like to thank everyone, the panelists and the commentators. We have to close now. We're trying to be punctual. And Ms. Savlova, I hand over to you for your closing statement.
Thank you, ma'am. Excellencies, distinguished guests, ladies and gentlemen, thank you for this inspiring discussion at the 71st WHO Regional Committee for Europe. I think it's very encouraging to see the commitment and the joint efforts of fellow ministers of health and leaders, academia, the WHO and civil society organizations to move towards a WHO safer European region free from harm due to alcohol. The Safer initiatives gives us a vision, evidence on which we can base alcohol policies, prioritizing those which are going to have the greatest impact, and a framework which we can use to move together towards this vision. International solidarity seems now more than ever important in light of the current challenges of the COVID-19 pandemic, and I am very delighted to experience the commitment that was shown and expressed today. With that, I am passing on to the WHO Regional Director for Europe, Dr. Hans Kluge, for his closing remarks of this successful site event. Thank you.
Thank you so much, Co-Chair, Mr. Flova, dear Alina, my good friend. I want to thank the different participants. I learned a lot. Really, it was an amazing session. So I had the Prime Minister of Scotland, the Minister, Dr. Murashko from the Russian Federation, then you, of course, dear Alina, our colleagues and friends from the civil society. We strongly believe in civil society. So I had Florence and Christina, and then Slovenia as the EU presidency. And in fact, we were telling with Karina, we had 2 members of the NCD Advisory Council on innovation of NCDs. In order to revive and catch up with prevention and control of NCDs, I established in December 2020 the NCD Advisory Council on innovations for NCDs to come up with a number of so-called signature initiatives which would have quick, high impact at the country level. And both Franco Sassi and Professor Rehm are part of that one, so that's also very good. And one of the signature initiatives is on health tax and alcohol. And in fact, Karina is a driving force behind this under the guidance of Dr. Nino Berzulli, our Director of Country Health Programs, who I want to really acknowledge and appreciate her efforts here. Thank you to you, Ilona. I didn't know, honestly, that you were behind the plan 30 years ago. I mean, that's quite something. We also have Dr. Mark Danzon connected, who was writing me. He was behind the other plan 20 years ago. So we have an amazing institutional memory today. And I see many champions, really many champions. We have Professor Jose Maria Martin Moreno with us, who is very strong on the cancer prevention and control, and the link was very clear, right there, Jose. And then also Professor Vytenis Androkaitis, the commissioner and former health commissioner, who, I mean, has a lot of determination. I see the whole time on the screen. And Vytenis also is a really very, very strong health champion. So I feel really very, very encouraged, I must say, very, very inspired. Also here at the WHO Regional Office for Europe, there was a time when we had ministers and we had the lunch, we had the red wine and the white wine. I mean, never too much, no, but anyway. So we discussed this with Nino and Karina. So we also celebrate without alcohol. So we have a lot of very healthy and very tasty juices in Denmark here. So we don't serve alcohol anymore. It's part of the new term I learned, denormalizing, alcohol. So I took a lot of message away on the pricing and the tax. And then that's amazing that I heard several member states and civil society calling for an international convention for alcohol. So this is something we have to really discuss. And the suggestion was also there, I think, from Christina on the ministerial conference to chart the way forward. I think that's definitely an idea which we'll take forward. And the next point that I had noted here is, yes, this is very much in line with the Moscow Declaration signed 10 years ago. It was amazing. We had both minister and the deputy minister, Dr. Oleg Salagai, with us. And I know I worked in 1995, 1996, for 2 years. I was working with Médecins Sans Frontières, MSF, in the former gulags, the prisons in Siberia, to implement the tuberculosis control program. And this was a whole different picture. If you were meeting with the generals and the colonels, I mean, and in the prison system was quite something. I remember very vividly. And if you compare the culture now, so this is for me an example that sometimes you think something is not possible, it's possible. And in fact, the Prime Minister Sturgeon called it determination to prevail. So I think that this session has laid out a very clear way forward and optimism to move towards a safer region, really. Free from harm due to alcohol. I mean, this is unacceptable. If 1 out of 4 young people between 20 and 24 are dying due to alcohol related, I mean, this is something we really cannot accept. And I heard the very, very strong commitment. I also heard the suggestions about engaging or not engaging with the alcohol industry. I was always told when I enter, we don't engage with tobacco industry and we don't engage with the arm industry. And that's also in our FENSA regulations. So definitely we need to have this discussions. That's a very, very important discussions that I heard. And maybe I will finish with what Dr. Oleg Salagai was telling, that surgeons save lives. My father is a surgeon, so it's true, he has saved a lot of lives, but we are saving destinies. I think that's very, very powerful, and that's very, very, very true. So I thank everyone for helping to save the destiny, particularly of our young people, and during this very tough COVID-19 times. And please be in touch and continue to support my teams at the WHO regional office here. Thank you so much. Stay positive and stay connected. Goodbye.